Focus on Health, your weekly dose of health and wealth information on KUTV.
Welcome to Focus on Health, where we create awareness on matters health. My name is Boari Michelle. Mental health awareness is key, and one of the mental health challenges that we're facing is anxiety. So what exactly is the link between anxiety and COVID-19? What causes it and how can we prevent it? Continue hitting us up on our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram. We'll get back to you on all your comments, queries, and also suggestions. But even before we see Daktari on that, here now is the health update. That was the very informative health update. With me on set is Daktari, and our topic today is anxiety and COVID-19. Don't forget to hit us up on our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram, and we'll get back to you during our conversation. Thank you so much, Daktari, for joining us today. It's a pleasure. So Daktari, even before we head on to our topic today, kindly introduce yourself to our viewers.
Thank you so much for having me on this show. I'm Dr. Tabitha Wangeri, Director of Wellness and Rehabilitation Services, Kenyatta University.
So Dr. let's head on to our topic today, which is anxiety and COVID-19. How would you define anxiety?
Anxiety is a state of mind. And this is a state of mind where somebody feels apprehensive, fearful, and afraid. And it isn't a simple definition, because somebody can be anxious because it's something that they're anticipating. Like when one is anticipating to come for a show like this, there is that anxiety one goes through. How will it be like? What do I need to do to prepare? That kind of anxiety is called reality anxiety, because it has an object. And that anxiety is important because it energizes the person to do the necessary preparation. Now, the other type of anxiety is the one which is actually anxiety disorder. This one, somebody feels afraid, apprehensive, but they cannot point out and say, this is what I'm afraid of, this is what is causing me tension, and so on. That now is what we call anxiety disorder.
Dr. do we have particular people who are more prone to contracting anxiety disorders as opposed to others?
Okay, according to research, people are prone to anxiety disorders if they have a genetic predisposition. Genetic predisposition means that this person has inherited that genetically. Then people can also be predisposed to anxiety disorders if they had childhood trauma, which was not resolved and which they did not understand, and therefore later in life it will manifest itself in anxiety disorder, either generalized anxiety, panic attacks, obsessive compulsive disorders, and so on. For the other one is phobic disorders. Then of course, when we're looking at men and women who are more prone to anxiety, according to research, women are more prone to anxiety than men. Then somebody may have had a good childhood, you didn't even inherit anything that predisposes you to anxiety. You didn't even have that childhood trauma, but something happens as an adult. Like you are exposed to violence, like gender-based violence or robbery, or you were in an accident, or like near close to death experiences. Those can bring in anxiety. And especially if the anxiety is coming because of trauma, it is called post-traumatic stress disorder. Yeah.
So doctor, I know that you've mentioned something about genetic disorders. Do we have children maybe who are born with this genetic disorder?
Okay, what may happen is that you can have like twins, identical twins, and both of them are born with the predisposition of anxiety disorders. Now, the environment will play a very major role in ensuring whether the disorder unfolds or it does not. If, let's say, one twin is shielded and they are not in an environment that will trigger that disorder, it may not manifest. If the other twin, on the other hand, is living in an environment that's likely to trigger the disorder will definitely manifest. Yeah.
So maybe like you mentioned something about gender-based violence, if they could see that,
yes,
maybe one twin would be more affected than the other, for instance. Is that correct?
If they are twins and they see that, and they have a predisposition, both of them are likely to manifest. On the other hand, you know, we have situations where you have maybe one twin was maybe adopted in another family, where the circumstances, the environment is very different. They encounter love, they encounter happiness and all that. That particular twin may not manifest the anxiety disorder. Yeah.
Doctor, you've mentioned various stresses that we have, and you know there's a lot of stress that's coming from COVID-19. What is the link between COVID-19 and anxiety?
COVID-19. Different people will be anxious differently. If, let's say, it's a normal person, they do not really have a disorder, they'll look at COVID, yes, they know it's there, yes, they know the things that you need to do to avoid, like wash your hands, social distance, wear a mask, and all that, and they will do exactly that. If there are those who are going for the jab, they'll go for the jab, and then they'll also live their lives normally according to what is allowed them with the travel restrictions and all that. However, if, let's say, a person has anxiety disorder, they will respond to COVID-19 very differently. They may be washing their hands throughout. They may be even afraid of moving out of their houses. They may not go to the shop. They may not go to the market. They may not allow anybody in the house. And so their main preoccupation will be COVID. And therefore, it will interfere totally with normal living. Yes. So that is if a person has the anxiety disorder and they are looking at the situations of COVID, they are forever very scared of contracting it. And every situation, they look at like a situation to contract COVID. Yes.
So Dr. what about these people who did not have an anxiety disorder, but you know, with the coming of COVID-19, which is new, now end up developing anxiety disorder? Is that really possible?
It depends on a lot of things. You know, last year, 2020, when COVID was new, if you asked people, do you know anyone with COVID? The answer would be no. Do you know somebody who has died of COVID? The answer would be no. This year, things have changed. People know friends who have been sick, who has been hospitalized. People know friends and neighbors who have died. That in itself can actually trigger some anxiety disorder of sorts. Yes.
Daktari, maybe you could guide us through the various causes of anxiety disorder.
The anxiety disorders, like I said earlier, they could be caused by just the genetics of the person. They could also be caused by early childhood trauma. They could be caused by traumatic experiences, even at any age, like being involved in an accident or witnessing robbery, violence, witnessing somebody killed. All those traumatic experiences are likely to trigger anxiety in somebody. Yes.
Maybe Daktari, you could hold on to that thought. We're going to take a slight commercial break, and when we come back, Daktari is going to be telling us more on anxiety and COVID-19. We're loving your feedback. Continue hitting us up on our social media platforms at KUTV Focus on Health on Facebook and on YouTube, and Health Focus on Instagram. I will leave you with the Did You Know segment.